just want to highlight here what I think are the most critical ones. For me, the satisfaction of the providers, the satisfaction of the patients, that is really the critical pulse. If physicians are not satisfied, then patients will be dissatisfied, will not have a good experience. And so really getting at that level and determining what can be done to improve provider satisfaction is really, really, really key. So it's in real estate, it's location, location, location. In telemedicine success, it's satisfaction, satisfaction, satisfaction. Technology performance. I've said numerous times in my writings that telehealth is not about the technology unless it is. So that assumes that the technology is reliable, it's user-friendly, it's secure, and it just performs. It's there when you need it, there's no glitches. And a lot of the telehealth solutions that are out there really work that way. What people are now discovering is that really it's about the workflow, how you integrate that technology into your workflow. And some technologies offer you way more workflow features than others. And those are, I think, in the long run, they're going to win because they enable you to really create a great physician experience and a great patient experience. And so that's also part of kind of technology performance. Reimbursement. We are still and probably will be in a fee-for-service world, and I know that a lot of people, especially in the critical access hospital and FQHC world, are very nervous on whether the limitations that were with regards specifically to FQHCs and CHAs will stay lifted, will be lifted for good. I think everybody is pretty much convinced, at least everybody I talked to, that the Medicare origination limitation will be lifted with regards to the rurality of the county and that the patient has to be in a clinic versus being at home. But still, there's a separate set of regulations for particularly, I think, this audience here that people are nervous about whether this will be addressed as well. And so reimbursement, yes, is critical. Also, as regulations change and maybe things are rolled back, or as payers are trying to maybe squeeze more profits out of us, it's also important to note whether reimbursements are being rejected, claims are being rejected. And I know most teams are already on top of it, but I know in the initial weeks of the COVID-19 health crisis, we had to fight a lot with the third-party administrators first and then with the payers to say, no, you are paying for health and you actually have it in your rules and regulations. So keeping track on that is critical. And then the last one, obviously, volume and modalities. What I mean is that the video or telephone. So those are really the critical four here: satisfaction, technology, reimbursement, and volume. And those are relatively easy to obtain, but they tell a great story. And if you want, throw on some miles as well. Good. I want to dive a little bit deeper just because I listed it as the first one here on the satisfaction realm. And actually what I'm doing now is I'm going to go through those four different areas here before in about 10-15 minutes we're going to break for a Q&A. So I want to provide a little bit more pragmatic detail on how you can actually implement the metric collection, the data collection on these levels. So starting with patient satisfaction, I have found the best response rate when you send an immediate survey link right afterwards, and when the physician asked them and said, you will get a survey link just like Fonda did at the beginning, right? She said, you get a survey, please take a minute, it really helps us out. And if a physician asks the patients to fill out the survey, the response rate is tremendous. It's very, very high. The other thing you can do if you don't want to do it with an electronic link based on your patient population, call patients within 4 hours, within 24 hours, give them a call, said, hey, so you had a visit with Dr. Miller, really interested in improving our telehealth experience, so is it okay if I ask you 5 questions? Will only take a minute. So, right, you get a lot of responses by that, and the insights that you gain from that data is very, very valuable. So it's a really good investment. And then provider satisfaction. So what I typically do when we roll out telemedicine or when a physician joins new is really give them an opportunity to jot down some thoughts, some ideas. I usually do it in paper after each encounter. if you can do it online, that's preferred because it makes data collection easier. But some physicians it's easier to have a sheet of paper next to them, and they can just check some boxes, jot it down, and then we can easily transcribe it. And you just do it for a few days. You don't have to do it for 6 weeks. And then on an exception basis or on a regular basis thereafter. So maybe every 6 weeks, every 3 months, just going back, so that you want to make sure that there's no backsliding with regards to the satisfaction levels. And also, if you've made some changes to the process, to the training, to the education, to the marketing, to the messaging, you want to make sure that those changes actually did improve the satisfaction, as was probably your intention in the first place. And also very important to look at the staff satisfaction. Now, telemedicine, we think about the video visit, but there's a pre-visit experience of scheduling and of preparing the patient. There's a post-visit experience of scheduling the next appointment, getting prescriptions ordered. There's the whole billing experience. And so a lot of people, everybody really, are involved in making the telemedicine service, the telehealth visit work. And so it's important also to get their input and their feedback, because something that the physician could be doing slightly differently may have a big impact downstream on billing.